Yeah. Why might abortion affect a woman's fertility? Can it affect fertility? Does it? Can it? Might it? Whether it's a chemical abortion or whether it's a surgical abortion, can it affect one's fertility? This is a really, really, really important question to consider. You can jump on the internet and look up all sorts of things, and most of the time you'll see not much out there in terms of can it and does it, or there will be a blanket statement of no, everything's fine, doesn't affect fertility, and don't worry about it. But actually, if you dig deeper and if you really go to the right sources, we know it can affect fertility. We know it does, it can. We don't really know how in terms of statistics, because that's a difficult one to get really clear data on. But we do know that the medical literature shows that there can be complications from having an abortion, and that can include things like the risk of preterm delivery, so giving birth prematurely. There's definitely an increased risk of that for future pregnancies. And while that doesn't seem something that's so disastrous, it can, and it can be at the time, because premature delivery, premature babies have all sorts of potential complications that can affect their health, their growth, their development. When someone's had an abortion and they find themselves down the track in a good relationship or in a situation where they do want to have a baby, the last thing that they want is for a very challenging situation with a preterm delivery, because it can be extremely painful, emotional, and possibly detrimental to the baby's health and long-term health. So that's one thing that must and needs to be considered as a possible complication. The risk of pelvic inflammatory disease is another one. This can be a risk to fertility and to future pregnancies, because particularly if you develop an infection in the womb after the abortion has occurred that's not properly dealt with. This is a very serious, potentially serious issue, because the pelvis, the whole pelvic cavity, is that whole region. It's not just the womb, it's the tubes, it's the ovaries, it's the uterus. Everything inside the pelvic cavity is all closely connected. So pelvic inflammatory disease is an inflammation of that whole region that can cause some very serious side effects, particularly if infection does spread to the fallopian tubes or onto the ovaries as well. So it can increase the risk of infertility, and it can also cause problems with ectopic pregnancies, where the embryo or the egg is travelling down the tube and it gets stuck in the fallopian tube. Any ectopic pregnancy for any woman is a pregnancy that won't survive, it can't survive. That kind of ectopic pregnancy usually involves that section of the tube being cut out and removed. Obviously the embryo is lost in that process, which is devastating, particularly for women who have had abortions and who down the track find themselves in a totally different set of circumstances and life circumstances where that they've found they are in a position to have a baby, want this. They've had to deal with possibly the trauma of abortion and the emotions that have had to be dealt with through post-abortion trauma time. And for this new life to be in jeopardy or to be destroyed through ectopic pregnancy is a secondary trauma, if I can say that. So that is something that is a higher risk for women after they have abortion. That whole idea of pelvic inflammatory disease, is the main reason behind that being an issue is because it can cause scar tissue. And I can show you some slides, 2 particular pictures I can show you of some scar tissue and scarring that can occur in the tubes, around the uterus, the uterine walls, or over the ovaries. that scar tissue can cause huge problems getting pregnant down the track. It can stop the baby implanting into the womb lining. It can cause problems with miscarriage down the track. And infection can cause this scarring of the tissue around the womb. The other symptoms that women might need to think about with pelvic inflammatory disease is that they can get pain around their pelvis or their lower tummy. They can have a lot of discomfort during intercourse, and that discomfort's like deep down in the pelvis. They'll notice that can be an issue. They might even have pain when they're going to the toilet, when they're urinating. Some women notice that they get bleeding between their periods or after intercourse. This is another symptom of pelvic inflammatory disease. And the other two things that they might notice are very heavy periods and painful periods as a result of that pelvic inflammatory disease. And some women get unusual vaginal discharges as well. Strange odours, strange colours, yellow, green, or an odorous colour odorous fragrance that can come from the whole infection of that area. It's inflamed. It's an issue. A few people can become very, very ill with pelvic inflammatory disease. Very high temperatures. It can be a severe issue. So the other things probably to mention as well in terms of can abortion affect fertility is that it can affect the cervix. Trauma to the cervix. The cervix is like a canal so you've got the vagina down the bottom here, and then you've got the cervix that leads up, and that cervix is like a canal where the sperm pass through. When an abortion is, surgical abortion is performed, there can be damage to the crypts that line the cervical canal. Those crypts produce cervical mucus, which is essential for pregnancy to happen. You can't get pregnant without cervical mucus. So if there's trauma to the cervical crypts in the cervix, that can cause long-term infertility. It can cause difficulty conceiving because of a lack of mucus or no mucus at all down the track. It can also be an issue for a condition called cervical insufficiency, where the cervix, when a woman becomes pregnant, can't retain the pregnancy in the upper region of the uterus. There's an incapacity of the cervix to tighten up and become like a protective plug at that time when baby's growing in the womb. Another risk is placental retention. So after an abortion, sometimes there can be retained parts still inside the womb or in the uterus of the woman, and that can cause infections as well. And heavy post-abortion bleeding is another possibility that can happen. So I guess overall, the main concern is damage to the uterus that can occur, scarring of the uterine wall. Because if you think about it, there's like what we call micro trauma that happens to the uterine lining because of the different medical instruments that are being used, especially if you get an infection following that as well. So there is a condition called Asherman's syndrome, which is when there's scarring between the walls of the uterus or the cervix in response to having that lining of the uterus removed during an abortion. So it causes the walls to sort of stick together, and it can decrease fertility potential, and I'll show you a slide for that, so a real life slide of that if that's helpful. Women who have multiple surgical abortions using a curette, which is another instrument, certainly are at risk of scarring of the inner lining of the uterus for those reasons. So technically anything that's going to cause inflammation in the uterus has the potential to affect fertility potential. And there can be injury to the organs around as well. When the doctor goes in to perform an abortion, there can be accidental injury to the organs nearby, like the bladder, for example, or the uterus, and that can cause punctures and other issues and infections that can have an impact as well. So though the impact or the possibilities may seem small, it's a serious potential impact that can play play out. And I think that women who have been through abortion, have been through a very, very difficult experience, are certainly, particularly vulnerable to any future impact on their fertility down the track when they find that, they are in a good position to start a family, and they reflect back on their lives, and there's, many are so concerned that it will impact, they're worried, they're anxious, they may even feel like they're not going to be able to get pregnant at all, and this just complicates it more for them. So these are very, very, very important things for any woman to consider before she even goes down that route of, possibly looking into abortion. Because it's not what most people will be told if they go to their GP. They won't really get that information unless they go to the right source to get the full picture, let's say. We're very quick to send people off for these procedures without thinking about the real impact. And that's what matters at the end of the day. What is my life going to look like from this point onwards? Because while we might think, it'll solve that problem, it can create another problem of an even, equal, greater magnitude. So, just taking that time to be calm and to think carefully and listen to what's going on in here, and face the thoughts that come into the mind, and project into the future and think about the future, because that's what's laying ahead for all these women in these situations, and for all of us.